COVID-19 awareness.
What is COVID-19? Coronavirus disease is an infection disease caused by SARS-CoV-2 virus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. The virus can spread from an infected person's mouth or nose in small bed particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to smaller aerosols. You can be infected by breathing in the virus if you are near someone who has COVID-19, or by touching a contaminated surface and then your eyes, nose, or mouth. The virus spreads more easily indoors and in crowded settings.
Signs and symptoms.
We all know COVID-19 affects different people in different ways. Most infected people will develop into mild to moderate illness and recover without hospitalization. These are the common symptoms of COVID-19: fever, coughs, tiredness, and loss of taste or smell. People with mild symptoms who are otherwise healthy should manage their symptoms at home. Number 1 is fever. Fever is a common symptom of COVID-19. However, not everyone who develops COVID-19 will experience fever. Some other common symptoms include cough, fatigue, and loss of smell and taste. Fever causes the body temperature to rise above normal levels. This is part of the body's immune response to infection. We all know cough affects our respiratory system that can cause trouble in breathing. If we feel that, we need to seek immediately to our doctor and tell them what we are experiencing. Tiredness. If we are not doing anything but still we are tired and we experiencing some of the body pain, we still need to seek immediately to our doctor. Is loss of taste and smell.
Keeping safe. Methods to reduce the spread. I will discuss the basic measures we can employ to take care of our own health and protect others. This includes how we can decrease the risk of people in our care becoming infected with COVID-19. First, hand washing. The most important thing we can do to protect ourselves is to wash our hands regularly with soap and water or rubbing an alcohol-based sanitizers on our hands. If our hands are not visible soiled, then hand sanitizer is recommended. Second, do not touch your face. Try not to touch your face. This is important because droplets containing the virus in your hands can be transferred to your eyes, mouth, or nose when they can infect you. Most of us touch our faces many times per hour without realizing. So, let's remind others to avoid touching their faces. Third, social distancing. Maintain at least 1.5 meters distance from everyone at all times. This is important because if you are too close to someone, you might breathe in their droplets if they sneeze or cough. When it comes to social distance, the farther, the better. Do not attend large public gatherings. Fourth, respiratory hygiene. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose when you cough or sneeze. When using a tissue, put it in the bin after you use it and then wash your hands. When you use your elbow, clean your hands after coughing or sneezing. Fifth, wear a mask. Wearing a mask in public won't help to protect you from infection. Only wear a mask if you are sick or you have the symptoms or you are looking for someone who have COVID-19. There is a shortage of masks and we need to conserve them to those who are around sick people. Number 6. Cleaning and disinfection. Operate from a principle that everyone you see and every object you touch outside your home is infected by COVID-19. COVID-19 has been seen to live on objects, surfaces, and clothing for multiple days. Regular cleaning on your environment, in your home, or in your car, or work is very essential. This is because droplets from an infected person fall on surfaces and transfer to someone who touched the surface. So you should regularly clean frequently touched surfaces, for example, tables, doorknobs, and light switches. Number 7. Food safety. From what we currently know, COVID-19 does not spread by food. However, you should still make sure you prepare food safely to make sure that you and others do not get sick from other diseases. Here are some tips. First, washing hands between handling raw and cooked foods. Second, cooking and proper handling of meat products. Third, using different chopping boards for raw and cooked foods. Fourth, ensuring all food is cooked thoroughly. Then lastly, avoiding preparing food if you have symptoms of COVID-19. Always remember, the best thing we can do is to wash our hands regularly, use respiratory etiquette, maintain social distancing. Individuals are reminded that this is not a virus which affects only the elderly, while many young people infected by this virus with only mild symptoms or asymptomatic. No one can be sure how it will affect them individually, and everyone is a vital rule in limiting the spread of the disease. So be responsible to save others. Thank you.
Keeping safe from COVID-19 does not mean having no social life for yourself or those in your care. It is important to maintain social relationships. This should be done virtually where possible. People who are unwell should be advised to stay in their own homes and not visit others. This is particularly important to enforce in residential settings where people should stay in their own rooms. Taking people in your care out in public. Regular hand hygiene, social distancing, and respiratory etiquette are essential in public settings. Practice hand hygiene after touching shared surfaces in shops or on public transport. To maintain social distancing, you should not attend public gatherings. What about the workplace? Use the same principles at work as you would at home. Clean your hands regularly. Practice social distancing. Practice respiratory etiquette. Observe at least 1.5 meter spacing between all people at all times. While indoors, the social distance should be at least 2 meters. Conversation should be limited to no more than 5 minutes. Workers should not be in the same cubicle and definitely not be reading over another's shoulder. Do not share desk or share equipment unless computers. Keyboards and phones have been thoroughly disinfected between users. Do not sit on common chairs or tables in the workplace. Meetings should be stand up and short. Travel and COVID-19. Currently, many cases of COVID-19 in Australia are imported from overseas. Therefore, if you are a frontliner worker, carer, volunteer, or have close contact with high-risk persons and you have recently traveled overseas, you may be asked to stay away from work for a certain period after your return. What if I develop symptoms of COVID-19? If you develop symptoms of COVID-19 such as fever, dry cough, sore throat, and fatigue, you should stay at home and practice self-isolation. Seek medical advice. It is important to call ahead first. Go to the Health Direct site or call the National Coronavirus Information and Triage Line on 1800-020-080 if required. What if someone in my care develops symptoms of COVID-19? You should keep them at home. Or if they are in a group facility, keep them isolated in their room.